Okay, good evening. We will continue our lectures. We are on the urinary tract system. We are done with the GIT, right? And then we are also done with the genital system, right? So we are moving on to the urinary tract system. Due to the time left, you have to review the anatomy and physiology of the urinary tract system on your own, right? You've done prostate cancer under the genital system, the male genitalia, right? And then benign prostate hypertrophy was also done under the male reproductive system. We also did, you've also done renal cancer with Dr. Pierre, and then you've done urolithiasis, kidney stones with Dr. Pierre, right? So we will move on to phimosis. Okay. So let's look at what phimosis is. Phimosis refers to constricted prepuce or foreskin that cannot be retracted of the glans penis, right? So if you take the penis, let's assume that this is the penis, right? So if this is the penis, the tip of the penis is known as the glans penis, right? And then when a baby is born, there is a skin that covers the tip of the penis, and that skin is known as the prepuce, right? So that skin is known as the prepuce, right? So what happens is the prepuce is what is circumcised, right? So about from 1 week after birth, the prepuce is removed through the process known as circumcision, right, which can be done by the midwife or a doctor, right, using, most of the time, a surgical blade is used in doing the circumcision, right? But some children, due to culture and other factors, the prepuce is left on it, right? So sometimes it becomes stuck to the penis, the tip of the penis, and then you can't even retract it, pull it over, right? So the process whereby it gets stuck to the penis and it cannot be retracted or pulled over is what we term as phimosis, right? So phimosis is constricted prepuce or foreskin that cannot be retracted of the glans penis, right? And most of the time it results from inflammation under the foreskin causing edema, right? So infection, because the prepuce cover it, sometimes when they pull it over and urinate, sometimes bacteria, some foreign particles get stuck under, right, which can initiate inflammation. So that can lead to edema and then cause the prepuce to get stuck at the glans penis, right? And then it is also defined as it's also defined as failure of the foreskin over the penis to be retracted. So it's the same as I've said, and it can also be due to adhesions, right? It may be congenital or acquired, right? So it means that a child can be born with it, or sometimes it can be developed later in life, right? And then the physiology is what I've talked about. Most of the time, penile formation starts 7th week of gestation and complete by 17th week of gestation, okay? And then most of the time, the prepuce is a normal skin. So I've said, it's a normal skin. Every male child will have it, right? And it has to be removed by the process known as circumcision. So when we don't remove it, that is when it can lead to this condition, or sometimes some people are born with it, as I've said, right? There are types of phimosis. We can have physiologic phimosis, as I've said, which is acquired, right? So it occurs naturally in newborn males, right? And then we can also have pathologic phimosis, which can result from infection, right? So physiologic is the one that is acquired, right? So it means that the person will be born with it, right? And then pathologic is when it is not there, but later the child develop infection at the glans penis, and then this prevents the prepuce from being retracted, right? Okay. Complications that can occur if it's not treated include what we call the balanitis. Balanitis is a complication of phimosis. Balanitis is a complication, Balanitis. It's a complication of phimosis where there's inflammation and infection of the glans penis. So phimosis can lead to infection and then inflammation of the glans penis. Most of the time it can be treated with antibiotics. It can be treated with antibiotics and then circumcision. Yes. So this is the treatment. We have another condition known as epispedia and hypospedia. Epispedia and then hypospedia. Right. So these are two other conditions that can occur. It is mostly detected at birth, right? So it occurs in male children, right? So, and then they are congenital abnormalities. It means that you are born with it. If you are not born with it, there's no way you will have it, right? So epispedia is a congenital defect involving abnormal placement of the urethral orifice, right? So the penis has the orifice at the tip, right? And that is the normal placement. But some children will either have the orifice placed above or below, right? So all these are abnormal conditions or abnormal placement of the urethral orifice, right? So this placement below and above is what we term as the epispedia, and then the hypospedia, right? Epispedia and hypospedia. The two main forms are epispedia and hypospedia, which I've talked about. The opening may be placed either near the glans penis, midway, or at the base of the penis, right? So it can be placed near the glans penis, in the middle, or at the base of the penis. So let's look at the differences. The epispedia and then the hypospedia. The epispedia occur when the urethral orifice is located on the dorsal surface of the penis, right, which occur with estrophy of the bladder, right? So if this is the penis, right, if this is the penis, and then if this is the penis, and then it occurs on top, on the dorsal surface, right, that is what we term as epispedia. So on top of it, on the dorsal surface, and then it's mostly occur with estrophy of the bladder, right? And then because there is opening there, bacteria can get access into the urethra and then cause infections, right? So that is epispedia. That is epispedia. We have types of epispedia which you can read on it. We have the glandular type. The types depend on where exactly it is located, right? Where exactly it is located. So we have the glandular, the penile form, and then the two types are the glandular and then the penile form. You can read about it. Glandular and then the penile form, right? So these are the two main types. Let's look at hypospedia. Right? Hypospedia. So let's assume that this is the penis. Right? So hypospedia is where the orifice is placed below, right? Is where the orifice is placed below, or what we term as the ventral surface. The ventral surface of the orifice. of the penis, right? So this is where the uterine orifice is located below the glans penis at the ventral surface, right? And then most of the time, it's, as I've said, it can be located at the close to the glans penis, the middle, or the close to the scrotum, right? Okay. Signs and symptoms most of the time is just you identify the orifice placed abnormally on the penis, right? So that is the main thing. And sometimes when the person urinates, if it's down, it will be coming down instead of the tip, and then if it's up, the urine will be coming up instead of the tip, right? Okay, so diagnostic investigations are the same as the diagnostic investigation for the urinary tract system, right? Types is also similar to the epispedia, which we talked about. We have the glandular type. We have the glandular type. We have the penile type. Right, and then the penoscrotal hypospedia, penoscrotal. So we have the glandular, we have the penile, the penoscrotal, and then the last one is the perineal hypospedia, right? So this means that the glandular is more close to the tip of the penis. The glandular is more close to the tip of the penis. The penile is follows, and then the penoscrotal means that it's close to the scrotum, and then the perineal can be in between the scrotum, the around the perineal region. Right, so these are the type. It depends on where it is placed. So you can Google for pictures and then look at how they are placed. So we have the glandular, the penile, the penoscrotal, and then the perineal type of the hypospedia. Right. So it has to be treated at birth, where it is the abnormal opening is closed, right? And then if there is no opening at the tip, an artificial one is created, right, for the child. So most of the time, post-operatively, you have to assess the incision site, right, for bleeding, etc., right? And then you have to also check the dressing. Yes, so you have to keep checking the dressing for bleeding, and prescribed antibiotics and analgesics are given to prevent infection and pain. And then you have to also change diaper when child passes urine and stools to prevent infection, right? And then perineal hygiene and then personal hygiene is also very important, right? I've given estrophy of the bladder as an assignment, right? And then bladder cancer, renal cancer have been done by Dr. Apia, as I've said. Right? Urinary diversion has been given as an assignment. So I hope after the next lecture, we will be done with the syllabus so that the assignment, you can start with the assignment. The next topic is renal or kidney transplant, kidney or renal.